Hi everybody, my name's Elliot. I'm a podiatrist here at East Coast Podiatry Singapore, and today I'm going to be talking about ankle pain and what does it mean. A lot of patients that come through my door will say, I've got ankle pain. Depending on which part of the ankle it is, will determine what structure is injured. So if we start off with the inside of the ankle, a common complaint with these patients are, I experience pain whenever I walk and when I'm standing as well, and it'll almost always be here and here. Obviously, when a patient comes in, the first thing I'll do is test the laxity of the ankle and also test the strength as well. And normally upon the strength test, if symptoms are present, it's normally a clear indication that it's going to be this structure. But most importantly, I'll have a look under ultrasound just to ensure that the health of the tissue is going to be deemed suitable for conservative treatment. And as we can see, that is looking rather healthy as I go around the ankle, still keeping that in view. So for this patient here, it will be a conservative-based treatment. Now the treatment that we offer here is a painless therapy called extracorporeal magnetic transduction therapy. And the idea of the machine is to stimulate blood flow to that affected tissue to increase that healing response. Now, depending on the severity of the injury will determine how many sessions a patient may require. By doing this conservatively, people can still remain active and participating in any sporting activities that they like to do. A lot of patients that come in, their pain is on the outside of the ankle. And what does this involve? First off, you've got a ligament that runs from this bone to here. You've also got one that runs from here to here, and one that runs from here to here. Now, just like the inside of the ankle, there is a tendon that can also be injured, and it runs from the back of the leg around that bone there and inserts into a bony prominence here. Now, when patients come in, the first thing I will ask is, have you sprained your ankle before? Because recurrence of this can mean that those ligaments are very laxed, which means you'll be very prone to spraining your ankles in the near future, and which also means you've probably got a little bit of a higher chance of developing arthritis in your ankle joint because things aren't being held tightly together. So when a patient will come in, to determine what site needs to be investigated, I will run through a series of tests. One of the most common ones is manipulating the ankle and inverting it, meaning I bring the foot inwards. Now normally patients will say, oh, I feel a bit of a deep pain in this region here, which is an indication that this ligament is probably affected. The other thing we're looking for is extreme laxity and maybe no pain, which means that the ligament is probably ruptured and will require a different mode of action to try and combat this. So what I will do is I will palpate those anatomical sites to see if I can stimulate any pain. Obviously, if I can't, what I will then do is use my ultrasound machine to check the health of those ligaments, which I'm going to do now. So what we'll do is we'll have a look at these ligaments here, and as we can see on its attachment, there are some tearing within the fibers, which states that there is an injury to that ligament there. What's most important is that I check all those other ligaments that I've mentioned to see whether they are intact. So this one is a little bit thickened, which means this has also sustained a bit of injury. And as we come up here, I can confirm that this one is actually fine. There's a bit of swelling around the surrounding tissues, which is very common with ankle sprains. And then most importantly, we're going to look at that tendon. And just like the one on the inside of the ankle, we're looking for that pebble there. And what we'll do is we'll follow that all the way around the ankle to ensure that there's no part that's injured. And so far, so good, right into where it inserts to that bony prominence that I marked, and actually everything looks fine. So now we've confirmed that the patient has actually injured two of the ligaments. We will then start EMTT, the painless magnetic therapy, and we will place that over the site of interest, and what this will try to do is repair the damage that's been done and try and get rid of some of that swelling as well. And then we will switch it on. So to accompany the treatment, the therapy, what we will do is I will always give patients an ankle foot orthosis. Now the idea of this is it's a device that comes up past the ankle joint. Now this is very, very important because, as I mentioned before, people that sprain their ankles once will have a tendency to do it again because the ligaments will just be very lax. So the idea of the brace is that it can move in a forward and backwards motion, but it does not move side to side. And actually, that's the mechanism of action that causes the ligaments to tear in the first place and become damaged. So patients will always take this with them and they will wear this whenever they do their sports. And what's pretty cool about this device is it's actually designed for NFL players. So if NFL players can wear it, everybody else can as well. Okay guys, if you found that video helpful, please like and comment. And if you were suffering with any ankle pain, whether it's on the outside or the inside, I will investigate for you what's going on and tailor you a plan so that we can get you back to being pain-free and mobile. Okay guys, take care. Bye.
For more information on related conditions, check out our other videos.